Hi, I'm Marianne Bohr with HIMSS. Today I'm here with Donnie Parish, Senior Vice President at GDIT, and we'll be talking about advancing tribal healthcare. Donnie, thank you for joining us today.
Thank you, Marianne. Thank you, Hims, for having me.
Of course. Now, can you tell us about the biggest challenges facing tribal healthcare systems today?
Yeah, it's a great question. I think tribal healthcare faces several significant challenges across the United States. One, it's important to understand that the tribal nations, there's over 574 sovereign tribal nations, and they have great cross partnerships across the federal agencies as well, such as the Indian Health Service. And then there are urban Indian clinics and healthcare organizations that are involved. There's chronic underfunding, limited access to care, and just like every U.S. healthcare organization, there's workforce shortages that are impacting this right now, such as a shortage of physicians across the board. There are higher rates of chronic disease and mental health and substance abuse issues, such as suicide and depression, much higher rates than the normal U.S. population. And then the infrastructure and technology gaps. Many of these locations are in rural areas across the United States that may not have access to broadband and high-speed internet, as well as getting modern equipment to their facilities. And then navigating federal and state regulations. Those are always hard to deal with when you have chronic underfunding across state and federal funding aspects. And then when we go into health disparities and social determinants of health, again, urban areas and rural areas, sometimes there's poverty, poor housing, lack of clean water, and limited educational opportunities.
Can you tell us how emerging technologies, such as telehealth and AI-driven analytics, can help improve healthcare access and outcomes for these tribal communities?
With these technologies, by addressing critical gaps in care, resources, and infrastructure, we'd like to see expanding access to care with telehealth, remote consultations, chronic disease management with remote patient monitoring devices, and then emergency and specialty care using virtual urgent cares or telespecialist consultations like dermatology and cardiology that can reduce your delays in diagnosis and treatment. Then you can have AI-driven analytics that can be used for medical imaging and diagnostics, so early disease detection, predictive analytics for public health awareness, so you could track and predict outbreaks, as well as medical imaging support, so you can interpret X-rays, MRIs, and help diagnose those things quicker. This also falls into other public health and resource management issues, so optimizing healthcare delivery, be it your supply chain or improving scheduling and staffing. AI has the ability to help forecast and drive those things. And then we talked about a little bit about the mental health and substance abuse issues, that the higher rates that we have in tribal healthcare. So things like virtual counseling or AI-powered apps that can be used for crisis interventions, I think are all very powerful tools.
That all sounds very promising. So, can you tell us what's needed to better support the adoption of some of these digital health solutions in tribal healthcare settings?
Yeah, I think there are five key areas that we're looking to improve, to enhance, advance through digital health solutions. And number one being the infrastructure development. And we would like to modernize, be it broadband and connectivity, where there's a lack of reliable internet access throughout the area, and upgraded facilities, not just the buildings themselves, the hospitals and the clinics, but the equipment that's inside of them, the biomedical equipment and other digital health tools that could be there. Secondly, funding and financial support, increased federal and state investments, and sustainable reimbursement models. We talk about telehealth being a key aspect here, but there are many states where the healthcare workers cannot work from state to state in different telehealth models. Workforce training and digital literacy. The healthcare providers now will be using these digital tools, but maybe not have been trained. They've gone to medical school and used different learning techniques, and now we're providing all these new digital health tools. So a training curriculum needs to be developed, as well as patient digital literacy. Something as simple as a Genius bar at a clinic or a hospital, where a patient can come in and learn how to use a remote patient monitoring tool. Then, if we get into something a little bit more relevant with the culture of the tribes, community engagement, engaging those tribal leaders, engaging the tribal government at the earliest onset of the development of these tools. We want it to be equitable in learning about that culture and being competent on how these tools can be used for these specific tribes. And lastly, a big piece of that would be data sovereignty and privacy protections. 574 sovereign nations across the United States, and they have the ownership of that data. So tribal data governance, and then making sure that we have secure health information systems protecting their data.
Well, Donnie, thank you for joining us today, and thanks so much for sharing your insights with us.
Thank you, Marianne. Have a great day.